This morning on The Real Story, we're talking about foster care in Connecticut as changes come to DCF, what's working and what's still needed to support some of the most vulnerable from childhood to breaking the cycle in adulthood. But first, what does the future hold for Connecticut hospitals' financial health operating at massive losses? We're diving into the costs and challenges, how the state could help, and what impacts your care ahead on The Real Story. Good morning, and thanks for joining us on The Real Story. I'm Emma Wolforce. Joining me now to talk about the state of our state's healthcare, Paul Kidwell, Senior Vice President of Policy for the Connecticut Hospital Association. Paul, thank you so much for being here.
Good morning. It's really wonderful to be with you. Thanks for the invite.
So the Office of Health Strategy's annual report showed us Connecticut's hospitals are operating at a loss, and CHA is saying the financial struggle is pretty serious, but not surprising. So big picture, what's going on here?
Yeah, and I don't think it's probably surprising to most families who I think through the COVID period saw their household expenses go up. And that's what hospitals in Connecticut are experiencing too. Our expenses are rising rapidly, and the money that's coming in to pay for those expenses is not coming in at the same rate. It's just like a household income, right? You have your expenses, you have the funds to pay for those, and it's created a really significant financial strain on the hospitals that are serving patients in Connecticut.
And we certainly see the healthcare professional shortage as well, staffing shortage part of this issue, and burnout as well for a lot of staff members. On the financial side, we see hospitals needing to step up salaries and wages for those employees, but as you said, the high cost of contract labor as well as supplies. What other impacts does this have, this staffing shortage, coupled with kind of the loss that's happening right now?
Yeah, if you think about, certainly hospital staff in Connecticut are amazing, and I think you hear from patients all over the state that the nurses at the bedside, other clinicians at the bedside, physicians, they're amazing. Yeah. But as you noted, the burnout is really extensive, and that period of time in COVID when it was really intense took a toll. Yeah. And so we certainly lost a number of staff and had to backfill that staff with what are called contract labor or travelers, right? People who may come in from another state to help for a small period of time. But that labor is much more expensive, because you're paying to get someone in really quickly. Right. That doesn't just have financial consequences, but that also has consequences for what's happening, in a unit of a hospital, right? Someone new coming in, they don't know, how the hospital is operating. They don't know how the other staff operates. So they're beyond the financial consequences. Certainly there are, just for how the unit works, but that certainly has compounded really significantly the financial strain.
And so I think another part of this too is prescription prices, high prescription costs, which everyone is feeling right now. But from a hospital standpoint, what are the impacts rising drug costs are having? Yeah,
well, you can imagine how many pharmaceuticals a hospital uses every single day. And we do our best to negotiate the best prices we can. But as has been well reported, pharmaceutical prices are always increasing at a rate much more rapidly than many other things in our economy, and people feel that too. So, hospitals need to buy the drugs that we need to treat patients, and we continue to do that. But that expense line grows and grows and grows based on those costs.
And I think a major component of this as well is health insurance, specifically Medicaid and Medicare reimbursements, but they're just paying cents on the dollar, right?
Yeah, and absolutely. So first is, if you come to a Connecticut hospital, you're going to get world-class care regardless of what insurance you have, and so people should rest assured that's not an issue. But when we think about at the end of the year, what our expenses, what's our revenue. Medicaid pays 62 cents on the dollar of care provided in a Connecticut hospital. Medicare pays 74 cents on the dollar for care provided in a Connecticut hospital. We have to figure out how to make up the difference. And so what happens is we go to the one place where we can negotiate, and that's commercial health insurance payers, right? We can negotiate the rates. So that underpayment by Medicare and Medicaid puts enormous pressure on that commercial health insurance market and those negotiations, so we can make up the difference. And frankly, if you saw the report, we still lost money, last year, $200 million. So you can only go along for so many months, years with that sort of dynamic.
And trying to combat that, Connecticut is starting a Medicaid and Medicare redesign. With this redesign, besides some possible cost restructuring, explain to me what that is. What's actually changing here?
We're excited about this because it's, you want to think about what can we do in the future, not only to stabilize the finances, but to make people healthier. And so our concept that we're excited to start really talking about it is working with partners in our communities, the community health organizations, the federally qualified health centers, and the state to think about how can we use Medicaid in a different way. So how do we invest in communities so people stay healthier, so chronic conditions like diabetes don't get out of control, that people aren't coming to the hospital emergency department for their primary care. We think there's just a really huge opportunity in our state to think about how Medicaid can be used as a tool for healthier people, while also making sure they're supporting adequately hospital care. So it's a big, exciting opportunity, and we're looking forward to talking more about it.
And what could be the long-term effects here, and what does the timeline sort of look like for when this could start?
I think the long-term effects is just a healthier population, which is the primary goal, right? Keeping people as healthy as possible. And that means a lot of things beyond just your medical care. It means that you have access to healthy food. You have that you're able to have transportation to your medical appointments. That where you live is a healthy environment. That you have opportunities economically. I mean, there's so many things that go into living a healthy life, and we think we have to think about it in a broader sense. It's a long-term goal, so it's not going to happen next year, but we're thinking in the next couple of years we can start to implement these types of things, and I think it'll bear fruit, in decades to come.
Right.
Yeah.
So in the meantime, though, because obviously, as you said, it could be great in a couple years, and even farther down the line. But in the meantime, we're seeing these losses. Is there anything the hospital is doing in the short term here to try and either better for the population as well as for the costs for the hospitals themselves? Absolutely.
So we try to be as efficient as we possibly can. Obviously, we want to be good stewards of the resource. But we need people, we need supplies, we need energy to run the hospital. People expect us to be, those doors open 24 hours a day, 7 days a week.
Right.
So we're really encouraging our state partners, our federal partners, to increase the reimbursement that we are getting for those state and federal run healthcare programs. That would take pressure off of those commercial negotiations that we talked about earlier. And that is that's in the very short term what we really need, require in order to make sure that people can continue to expect that world-class care. And I think people in Connecticut expect hospitals to be part of their communities too. And so we want to be able to have the resources to do that.
And does the state need to get involved anymore here? And if so, for you, what are priorities for this next legislative session?
Yeah, I think there are a couple things that we're going to really focus on. Number one, workforce.
Yeah.
Our workforce is the key, right? And so, we need to think about how do we grow a pipeline of nurses, of technicians, of all those people in the hospital. How do we grow that pipeline and then encourage them to stay here in Connecticut?
Right.
The other thing, and it's been in the news, is we in the state have this thing called certificate of need, where if you want to acquire a CT scan machine. If you want to have two hospitals partner with each other, you have to go through this certificate of need process, and the state has to say yes. And so we think that process is taking much too long. It's much too expensive. And honestly, because of that, it's not being thought about as a way to help support not only the state's economy, but healthcare delivery in communities. And we think there needs to be a reimagination of how that process works. And then we talked about it, but the state does have a part to play in Medicaid reimbursement. The state runs the program. They set the reimbursement rates, and we think they need to be better partners in that program.
Well, Paul, definitely a lot going on right now and a lot to be prioritized next legislative session. Thank you so much for being here with us again.
Real pleasure. Thanks for having me.
So we'll certainly be following and closely covering this redesign and the discussions to come, but don't go anywhere. Up next, we're talking to two DCF employees about foster care in Connecticut. Stay with us.